Optician, and what I've been doing for about 30 years is helping people with their eyeglasses. So when you go to the eye doctor or the optical clinic, they give you a prescription and then you go order glasses. I'm one of the people that's involved in helping you with the glasses part. So when you bring your prescription in, the optician usually will look at the prescription and talk to you about what kind of lenses you want and what you want those lenses to do, and they'll help you pick out the right frame and help recommend the right kind of lenses and materials to get your vision the way you want it through the glasses. And it goes a little further than that. Once the glasses are manufactured at the lab, they go back to the office and we do an inspection to make sure they're made correctly. And then when you come to pick them up, the optician usually will sit down and fit you with the glasses and make sure they're adjusted and lined up and that you're seeing good. So the other things we do besides just fitting you with glasses and making sure they're made right is if you don't see good out of your glasses, the first stop is to go back and see your optician and see if it's something with the lenses or the prescription in the lenses. And we can compare your old glasses and new glasses to make sure if there's a big difference in prescription or lens design, we can kind of narrow down what's causing your issue with the glasses. And we can correlate that with your doctor to see if the doctor needs to see you again or if we need to just change something about the glasses. And that's what I'm doing here. Is I know a lot of times we don't get around good. And in the years I've been doing this, I see a lot of people coming in for their yearly or every other year checkup and the glasses are not in great shape. And the question I always ask is, well, when was the last time you came in for a complimentary adjustment? And a lot of times people say, well, I don't drive anymore, so I usually just come in when I get my eyes examined. And that's why I'm here, is to provide that service you would normally get at your optical shop or eye care clinic for you, because I think it's important that you have good vision. And I also like to talk to people about their eye health. It's important to get your eyes checked at least once every year or two. If you have Medicare or a Medicare alternative, often the Medicare exam is covered by your insurance. There might be a small out-of-pocket fee for the doctor to check your prescription for glasses, because Medicare plans consider that a routine service, not a medical service. All right, these are in pretty good shape. You've got some, nice to meet you. Okay, they look like they're a little low on this side, so I'm gonna make a little adjustment with your frame.
Okay.
Because you've got the multifocal lenses, if they don't line up good, it can throw your vision off a little bit. And that just happens, you know, we wear the glasses and they get out of shape. Looking the glasses over and making sure all the parts are lined up good and snug. Get you cleaned up. So for cleaning, I usually recommend a little mild soapy water. That's all I'm using, is a couple of drops of Dawn dish soap and water, and then we're gently wiping the lenses to remove any dust or dirt before we rinse them off and wipe them with a cloth. Simple and easy to do, and it won't hurt your frame or lenses. And it doesn't have to be Dawn, it can be a generic brand, but some kind of non-lotion dish soap is all. Feel okay? Good, just like new. All right, nice. They're made in Austria and they use a real good quality titanium material. Yeah. Yeah.
They were expensive.
Yeah, just the frames usually are around $400 or so.
Cannot read it. Yeah, me either.
Does that feel a little better?
I think so.
There's such lightweight frames, it
Yeah.
probably feels like they're hardly there. Tightened everything up. So I was probably making them a little wobbly, and now they should be more stable.
They are. That feels good.
Good.
Thank you very much.
My pleasure. Nice to meet you.
Nice to meet you.
Loose. Yep, we can
They
tighten it.
probably need to be cleaned,
Okay,
because I don't have anything to clean them with.
we can tighten them up for you and get them clean. To be honest with you, the best thing to do would be to just schedule an eye exam with an eye doctor. And usually you have to go into their office for that. I've been trying for 2 years to find a doctor that does mobile. Unfortunately, the cost of the equipment and the reimbursement from insurance, or if there's something going on with the eyes, with your concern about one eye seeing better than the other, especially if you haven't had your eyes checked for a few years, there could be something going on there that needs to be addressed by an eye doctor. I would highly recommend pads on, because the missing pad, I put 2 new ones on there for you.
Okay, good.
Okay.
That'll help so much.
Yes, it will, because the ones that I have are a different shape than your original ones. So you got new
Okay.
pads.
So that balances.
Yes, that way they're balanced, they feel comfortable. Do you want to try that on and make sure it feels okay? And these are all reading glasses, I'm guessing, right?
Well, not all of them, because
Okay.
I like to walk around the lake.
Yeah.
And when I do that, I find myself sometimes,
Right, because they're a little
Keep it
strong for
over.
far away.
Right.
Yeah. Keep them up.
good.
All right?
Oh, right. Well, thank you. They're all shiny clean.
Yep.
Okay.
You're in good shape.
Yep, I'm in good shape. Thank you so
You're
much.
very. I think I've worked on your glasses before, haven't I?
I imagine so, but I think for a pair.
Okay. Well, let's tighten them up for you. It's if we're not seeing good out of our glasses, either the glasses are out of adjustment, so the prescription's out of alignment, or we need a new prescription and we're just not seeing good because the prescription's not accurate anymore. So it's a good idea to get your eyes checked regularly, and a doctor can look for any changes in prescription as well as any health conditions that affect your. So I tightened everything up and adjusted them, and they look like they're sitting more level and even now. How's that when you look around through them? Do you feel like you're seeing okay?
Yeah.
Good. So they're probably out of alignment a little bit, and with the multifocal, if they're out of alignment, then the prescription's not working as good as it could be.
Okay.
For you,
Okay.
get you tuned up and tightened up. So yeah, one of the first things I do is I do basically a bench test. We make sure they're lined up pretty good, and then we straighten them up as needed and tighten all the hardware. A device like a computer, smartphone, tablet, or flat screen TVs, they all use blue light technology. So we're getting a lot